All right. Hi, everybody. Thank you for being here with us tonight. I know we usually stall a little bit at the beginning to give folks going, so give folks a chance to join. So I'll just chat for a bit. But so tonight, the town hall theme is going to be a conversation with IOCDF leadership. We are kicking off an excellent series of town halls for Minority Mental Health Month, which lasts for all of July. So today is July 1st, very first day of it. We're very excited to be here. We got some great content and great discussions to have tonight. But yeah, we can just hang out for a couple more seconds to give folks a chance to join, and then we'll hop right to it. But yeah, I can't believe it's already July.
You can sing us a song, Steph.
Oh, you don't want me to sing a song? That would not go well.
It'll be an exposure.
Exposure. She sings karaoke all the time.
Oh, we need a video of it.
There's plenty of video of it. We'll see it. If the world wants it, we can make that happen.
As people are joining, they might want to post where they're from. We'd love to see where across the country or internationally we've got folks.
Yeah. I can tell you right now we're from 3 separate locations on this panel. Jeff and I are here in Boston, and Susan and Jenny, I don't know if you want to say where you're from.
I am
Los Angeles.
Yeah. Sunny Los Angeles, you can tell, nice and golden in the background.
And I am from the Southeast, from North Carolina. It looks like we've got Texas and West Virginia on the line too. That's fun.
Fantastic. Hello.
Hi, Texas.
And I agree with you, Tess. Music is a beautiful thing to help heal the mind, though maybe not the way I do it. But when other people sing or play instruments, I agree with you. It's lovely.
I think you're supposed to say really nice things about yourself nowadays, Steph. So.
Oh, you okay? I am a work in progress when it comes to it.
Much better. Hey, Pennsylvania. Suburbs of Philly. I like to travel up there. It's been a while now, but I hope to get back again soon. All right.
Tim Thomas works at the OCD Institute.
Oh, excellent. I'm glad you can join
us.
Great. All right. Well, so it's been about 3 minutes, so let's maybe get started. Oh, we can say hi to Deirdre from New Hampshire. Very cool. You're kind of our neighbors here, for those of us who are in Massachusetts, at least. All right. So again, welcome everybody. So we're kicking off a fantastic series of town halls about Minority Mental Health Month, which is July. So as it's July 1st, we wanted to start things off with a conversation with IOCDF leadership. I know I'm a new face for you all. You're used to seeing Ethan here, and he has shoes that I could never dream of filling. Or if we're being positive, I can say I'm a work in progress at filling Ethan's shoes. But my name is Stephanie Kogan. I'm the program director here at the International OCD Foundation. I've been here for about 7.5 years, love the organization, clearly, and I love the work that we do. I'm going to introduce my fellow panelists in a bit, but first I just wanted to get through some housekeeping notes. So just as a reminder, this town hall is intended to serve as educational content, and it's not intended to replace therapy. If anyone has treatment-related questions, please be sure to work with your local provider or contact a local clinician. The IOCDF is not a crisis hotline and should not be used if you are in distress or feeling unsafe. If you are in a crisis or if you're ever feeling suicidal or unsafe, please go to your local emergency room, call 911, or call the Suicide Prevention Hotline at 800-273-8255. So another reminder, please be kind and respectful to one another as you participate with us. We're here to support each other, and we try to create as safe a space as possible during these town halls. Be reminded that this is a public forum and it is being recorded, so it will be publicly available on the internet for folks to watch both now and after the fact. So just keep that in mind as you participate. And with that, without further ado, I want to start introducing the folks we have here. So with this being a conversation with IOCDF leadership, we have the top brass here tonight. So I'm going to start with Susan Boaz, who is to my left here. She is a parent of a child with OCD and PANS who is now a teen. She has personal experience working to develop age-appropriate tools for ages varying toddler to teen. She is the current IOCDF board president and the executive director of the Pandas Physicians Network. She believes that every child wants to overcome OCD and is excited to help families find tools and techniques that are right for their child. In her spare time, Susan is an entrepreneur living and working in North Carolina. So hi, Susan. Thank you for joining us.
Thanks for having me.
Great. And then right below me, we have Dr. Jeff Szymanski. For the past 12 years, Jeff has been the executive director of the International OCD Foundation. Previously, he was the director of psychological services at McLean Hospital's OCD Institute. Dr. Szymanski is also the author of The Perfectionist Handbook, which is based on his work there. He is the immediate past president and co-founder of the ACBS New England chapter, which provides education and peer consultation on acceptance and commitment therapy, ECT, for a regional audience. He is a clinical instructor in psychology at Harvard Medical School, and he has supervised pre-doctoral psychology interns, psychiatry residents, and has run CBT seminars. Hi, Jeff. And then last but certainly not least, we have Dr. Jenny Yip. She is the co-chair of the IOCDF's Diversity Advisory Council. She's a clinical psychologist, author, speaker, media contributor, and nationally recognized OCD, anxiety, and parenting expert. Dr. Yip has treated severe OCD and anxiety disorders for over 2 decades and founded the Renewed Freedom Center and Little Thinkers Center. She's board certified in behavioral and cognitive psychology, is a clinical assistant professor of psychiatry at USC Keck School of Medicine, and is author of Productive, Successful You, and co-hosts the Stress Less Life podcast. So thank you for being with us, Jenny. Great. All right. So let's kick things off. So tonight, the general structure we're going to use to organize the discussion piece of this before we get to some Q&A, and we'll be happy to take some questions. So please feel free to, as we're going along, please type them in and we'll get to them towards the end of this. But for the discussion piece in the interim, we have 3 main questions that we're hoping to talk through and answer as this IOCDF leadership group. So the first is, does the IOCDF care about diversity and inclusion? If so, how come? The second is, what has the IOCDF done in the past and what are we currently doing to serve diverse communities? And then the last question is, what can we do moving forward to better serve diverse communities? So with that, let's start with our first question. So does the IOCDF care about diversity and inclusion? And if so, how come? Susan, you want to take a stab at coming out first?
Yeah, I'd be happy to. I think the answer is yes. The simple answer is yes. But the more important answer, I think, is why. So our mission is to help as many people with OCD live full and productive lives as possible. And the thing that we know about OCD is that the illness itself does not discriminate. So you can get OCD regardless of your race, of your socioeconomic status, of the country that you live in, of your gender, of your sexuality. So with those facts in mind, helping as many people as possible means that you have to help a wide diversity of people. Figuring out what the challenges are to help each of the different communities that are impacted it can be a challenge, but it's one that we have to attack. And I really like to make this a little bit personal by saying that it usually takes between 14 and 17 years for someone, when they first start suffering with OCD, to actually get diagnosed. Okay, so we know that, and we know that OCD doesn't discriminate no matter who you are. But we know that the healthcare system historically has discriminated. So if you think of a person who has good access to care and they get OCD when they're 5, they're still going to lose their entire childhoods to OCD if they're not diagnosed earlier than the average time now. They're still going to be in their 20s when they first get a diagnosis. That's unacceptable. But now when you start to think about someone who, let's say, is in the Black community and is not diagnosed as quickly as someone who is in a different community. So when you think of a young Black man, 7 years old, who perhaps is misdiagnosed with ADHD or is misdiagnosed with behavior problems in elementary school and does not get a new diagnosis for 20 years or 30 years or a lifetime, that person does not have the ability to live their life to their fullest because of OCD. And that is absolutely unacceptable. So our goal is to shorten that time from onset to diagnosis for everyone. But I think it's critically important that we really look at that very closely from a diverse community. We really just want everyone to live fulfilling lives. And as we continue to talk about race and diversity, and we continue to learn more, and we're seeing some great research studies out, we start to understand what the different challenges are for each community. And that new lens of perspective really helps us understand what needs to be done. And I think we have a lot of really good ideas on that now, and we're going to talk about that today. We're already doing a lot of good things, but there's so much further for us to go. It's genuinely a lifetime of work, and we're not shy about talking about where we still have opportunities.
Jenny, would you like to chime in?
Sure. Just to piggyback on what Susan was saying, there is a huge mental health disparity, right? So we know from the research the little research that does exist, that there is a huge discrepancy between when a person gets diagnosed or actually their symptoms begin and when they actually have access to treatment, to appropriate treatment, not just any, treatment that you see on the web. And the reality is that there is a even bigger gap because of whether it's cultural barriers or a lack of availability of treatment in other populations. So because of that, there is a huge disparity between people of color having OCD, yet not getting the treatment that is so needed. And like what Susan was saying, one of the biggest things that I feel like is a disservice to our society is not doing enough to inform people that evidence-based treatment exists. It's not decades of talk therapy, it's exposure and response prevention therapy, yet not very many people know about it. Now, if not very many people know about it, even within the average population, right? Imagine if there are other cultural barriers to adding stigma about mental health. And if you already have a cultural stigma, then you actually won't be even considering treatment, right? Never mind evidence-based treatment. So that will actually delay a person thinking and getting treatment even more so. And that to me, 14 to 17 years, that is a very long time to be suffering. Can all of you imagine like being burned alive for 14 to 17 years? And that's what a person would be experiencing if they have OCD. So if that is the time frame for an average person, imagine how much worse is it for a person of color.
Yeah, and so I can weigh in maybe a little bit more historically to answer the question about is diversity important? And so, as Steph mentioned, I've been with the organization going on 12 years. So I started in 2008. Susan came on in 2011, and her observation of the organization in 2011 is, why are you only focusing on adults? Which was the case, right? We weren't even focusing on pediatric OCD. And she would just very, nicely and repetitively in board meetings say, you do know that OCD starts in childhood, right? Shouldn't we be doing some programming on kids? And so that's been kind of the evolution for the last 12 years I've been involved is looking at, again, who are we doing a better job with, and then who are we not doing as good a job with? And we wrapped our hands around the pediatric initiatives. But even back in 2012, Michael Spigler, our predecessor to Steph, we had our Chicago conference in 2012, and he said, look, there's a big Hispanic population there. This is an opportunity to really engage that population. Let's at least have a couple sessions done in Spanish. And I was like, that's a great idea, right? And so I think that between 2012 and 2020, our focus on diversity issues has continued to increase and has continued to snowball. And another kind of turning point was working with Monica Williams. And again, this was following the 2015 conference. And she became our first kind of diversity consultant, and she was pivotal in setting up the Diversity Advisory Council, of which Jenny and Steph actually are the co-chairs of. And they have pulled together a couple dozen folks that have been working with us for the last 3 or 4 years, have built a strategic plan about what we need to do in terms of increasing diversity issues, and also not just helping us develop that strategic plan, but helping put some teeth in and put some steps into that. And so when we did our strategic planning in 2019 for the next 5 years, there were 2 things that showed up, and they were kind of prophetic, right? Because one was we need to do more in the virtual space. And here we are doing more in the virtual space because of COVID. And the other major issue in 2019 was we've been talking about diversity. We need to keep turning the volume up. And again, I don't need to speak for everyone on the panel, but I think when the Black Lives Matter, again, that movement exploded this time, this summer, it's heartbreaking to see that continues to go on. And there's yet again a need to turn the volume up on what we need to do for our diverse population. And again, I'm just going to echo what Jenny and Susan said. People of color are part of our community, but they aren't in our community, and that is a problem. And that is a failing on our part that we don't have more people. And again, this is, Steph comes from a public health background, and she's been saying we need to collect demographic information. How good are we doing? How well are we not doing? What kinds of diversity is showing up at our conference and is showing up at our events? And if it's not showing up, what are we doing to increase that?
Great. Yeah, I don't think there's anything more I could add that you guys haven't already said. So I think that's that's a great place to start for this conversation. I guess something that we probably should acknowledge, and just, the elephant in the room. This is kicking off a Minority Mental Health Month series, and yet 3 of the 4 folks on this call are white people. So when Jeff mentions we have an area of growth in diversifying our community and making it truly representative of all those who are affected by OCD, we also have some work to do that we've been talking about for the past couple of years in diversifying the people who represent the community on the board and the staff level. So I don't know if Susan was there. Did you want to talk a little bit about that?
Yeah, no, I'd love to. So we actually got a question earlier today that I think this might be a nice time to answer as well, which was, hey, are we welcomed if we're white to come to these town halls, and what is our participation level? So I'll start with that, and then I'll talk about board and staff. So the first piece of that is that absolutely everyone is welcome to be here. And in fact, we encourage it. We're going to have a series of these town halls throughout the month. And we're going to have all kinds of speakers from very diverse backgrounds that will be here to talk about what the research is showing, how traumatic racial experiences may impact both getting therapy and your experience of OCD, whether or not someone who might have PTSD from traumatic experiences might have a different experience in working through OCD. So you'll learn a lot about what's happening. And I think for everyone here, we're going to learn a lot. And only through learning can we be better allies, and can we put things in place to continue to support those communities. So I just wanted to say, first of all, everyone's welcome, and we really hope you'll learn a lot here. Then that takes us to the board. When we talk about diversity on the board, I think the thing that we've been saying over the last couple of years is the process is not working. And to be perfectly frank, we're not great at board recruitment, period. That has been a real challenge for us historically. Some of that has to do with the fact that we're a mental health board. It's not a board where you're paid to participate. You're a very, very active volunteer. And so there's a lot of people that have still been confidential about their illness or their family's illness. There's a lot of reasons why people may not want to step up to a board level participation. So there's some general challenges. I think we've brought one new person in the last 3 years, and I've been president for 2 years. And we had a very specific need for someone to help us with development. And we knew someone that had just retired, and she's terrific. And so she was brought in, but that did not help us address diversity. And so the first thing we have to kind of throw out there is our process is not working in terms of bringing diverse folks on the board, because if it was, it would have happened in the last 5 years, and it hasn't. So what we're really tossing out right now is saying, okay, parts of this process are working and parts of it are not. And my initiative, as I've shared with Jeff a number of times now, is that by the time this next tenure of mine as president is done, that we will have an extensive short list of folks from a diversity perspective, and then also from some of our other board assessment needs that future presidents will be able to tap into to bring in board membership. Because it usually takes people a couple of years to consider getting to know us as a board, us getting to know them and what they bring to the board, and then ensuring that their specific talents that there's an opening for it. So, for example, we try not to have too many parents of children with OCD on the board at the same time, because we also need to have folks who have experience in BDD or folks that have experience in finance or development. So there's a number of areas on the board we're trying to fill. So the top priority is that we find diverse candidates for the board of directors. We are very, very open to that. If you have recommendations, you may absolutely send them in for us to add to our short list and begin to explore them. We really welcome that. We're looking for more and more community engagement. We look like a big organization sometimes, but we're actually not that big. So that's really another one of the challenges. I hope we present very professionally, but we actually have a very small staff and a relatively small board, and we get a lot done with a fairly small amount of money. And so we're really looking for additional partnership from folks in the community to help us develop diversity on the board and in staff. And I'll let Jeff speak to that just a little bit in terms of what we've been doing in terms of staff, because I do think that's an area where we've had some real success. Does that answer the board side of that sufficiently, Steph?
Yeah,
okay.
Thank you.
Great. I'll turn that over to Jeff.
Yeah, I think from a staff perspective, again, around 2015, 2016, when I started in 2008, the organization had just moved up from Connecticut to Boston. And so I started off with a program director, an admin assistant, and a finance manager. And so there were 4 of us to start. We have not been wildly successful with attracting diverse candidates, although we have had a number of folks of color. We have some folks of color on our staff right now. We have members of the LGBTQ community on staff at the moment. It is something in the last 3 to 4 years where there has been a concerted effort where whenever a staff position has opened, we have gone out of our way to reach out to organizations who can help us find diverse candidates. One of the things that we talked about, we had a fair amount of staff turnover for all kinds of good reasons last year, people just moving on to next chapters in their life. And so we had, I think, 6 new staff members within the last year and a half. And what was interesting in that process is, again, diversity was in that conversation quite a bit. And we actually were able to hire some diverse candidates. But it did open up a larger discussion. We have a new director of operations, Matt Antonelli, and he has a good amount of experience from an HR perspective. And he had been talking about, we need to do more diversity training with the staff. We need to be, just in terms of how we interview, how we are open and inviting to diverse candidates. And again, I think, Susan, you and I have been talking about, the board identifies different training opportunities for them to get better as board members. And again, diversity was on the docket this year. Jenny's going to come in and do some diversity training with the board, but also we're going to be hiring a consultant to work with both the board. Matt has been interviewing some folks and reaching out to some of his old connections to start bringing some of that in as well.
Great. Jenny, I don't know if you had anything you wanted to add. I know you're not board or staff, but you are a co-chair for the Diversity Advisory Council, and so you are one part of our leadership. Yeah.
Well, I think the important thing to mention is that when the Diversity Advisory Council started, I believe it's been 5 years now, I remember Monica reaching out and saying, we have this idea, this is what we want to do, will you join us in the steering committee? Of course. And then within the steering committee, we kind of had to figure out, okay, well, what does this mean? What is our mission? What are our goals? What are the different parts that need to be implemented in order to meet the goals that we had? So that's how we started with the strategic plan. And what we came up with was that there are different areas where we needed to meet those goals, right? So we have different subcommittees. We developed different subcommittees. One of the subcommittees dealt with diversifying the board, diversifying IOCDF membership, diversifying each of the different areas that are important for IOCDF. And there are other subcommittees as well, such as how do we increase training for OCD in clinicians of color? How can we increase the availability of treatment in populations where there are more people of color? How can we make it easier to access treatment? So we have different subcommittees, and I think it's important to recognize that we have been on this path for the last 5 years, at least, in attempting to diversify IOCDF, right? So with each of the subcommittee and the work that we have come up with, we pass that on to the board. And then we inform the board, okay, these are what our goals are. And there has been this back and forth dialogue to meet that goal. However, I mean, with all things, it takes time. I mean, it took us 2 years just to be able to come up with this strategic plan, just because there wasn't anything like this. And each of the subcommittees took the time to do the research to come up with the strategic plan. So we are slowly getting there. However, it has been on our minds.
And I have to say, that the diversity committee has been absolutely one of the best things that's happened to us as an organization in the last 5 years. And that's Jenny and Monica, but then also so many other folks that sit on that committee, because, you know, we want to reach as many people as possible. And so having folks that are so willing to spend 2 years to develop a strategic plan around diversity, it just, I find that to be both emotional and also strategically important to us, that we'll be able to reach that many more people because of the efforts that you guys are doing. And I know there are, you know, I always turn back to the kids for starting place, because I don't want to have adults suffering with OCD, right? I want people to get diagnosed from their kids and get the help. And the only way we can do that is if folks like you are helping us so much with developing a strategic plan, so we know where we're going and we can reach more people. And I'm just deeply grateful for that.
Yeah, I think what's cool about the council is that they have helped us. You don't know what you don't know, kind of thing. And so one of the very straightforward things, like you guys exhibit at other conferences as a way of marketing your organization. Did you know that there's a Black Psychologist Conference? We're like, we did not know that. That is an awesome idea. And as soon as we heard it, I think we exhibited 2 or 3 different organizations, conferences last year, Steph, that were focused on, again, people of color. Again, just the things that you don't think about. If you're going to access the Black community, you need to do outreach to churches. If you're going to get the word out about the conference, you advertise the Hispanic community through the radio, right? So these are things that we didn't know about, that kind of expert consultation has really shifted a number of things, and I think made us a little bit more effective. Again, tons more to do. Don't want to say that we're all over this. Tons more to do, but really having experts give us that input has making us drive the car, I think, a little bit more effectively.
And I think we're going to talk a lot more about this as we kind of go along, but one of the really important things, and one of the reasons I'm so excited that we're doing these town halls, is because the way that you reach folks is by telling stories. And so everyone that tells their story about OCD, and everyone doesn't have to do it, it has to be what you're comfortable with. But whether you tell your story to one other person or to 50 other people, or you go to social media and you tell lots of stories, so many people don't even know what OCD is. You know, they joke about it. They say, oh, I'm so OCD. I heard it in a business meeting today. I'm so OCD about getting our forms in on time. I was like, okay. So we hear that, and yet as a result, people don't know how badly people with OCD suffer. They may not know about the subtypes of OCD. They may not know about what body dysmorphic disorder is or what scrupulosity is. And so we need people of every race, sexuality, gender, age to be telling their stories, because those are the most relatable ways for us to educate people about OCD. So when someone shares a story about their intrusive thoughts, that lets so many other people know that intrusive thoughts are a part of OCD and that ERP therapy can help. If someone shares their story, we had a young man who, Riley Sisson, who shared his story at the conference very bravely about addiction and OCD. And it was really the first time our community had talked openly about addiction and OCD. And it makes sense that if you have a mental illness that is not well treated, that you might turn to substances to try to treat that. Again, why is it so important that we treat it early in childhood? Because we want to make sure we catch that and give people the right kind of help before they turn to substances. Well, Riley really awakened the community about the fact that it's very hard to treat someone who has both substance abuse and OCD. And the community was not entirely clear on what should be treated first or could be dual treated. And so now those conversations are happening in our community. And they're not happening because I started talking about it or Jenny started talking about it. They're happening because someone who suffered from OCD was willing to step forward and very bravely tell their story on a pretty big platform. And he changed lives. And Riley actually passed away, which was just a very rough time frame, but his legacy is something that lives with us every single day, and it's something that we work on. So when we talk about diversity, we say, well, there's this amazing opportunity for folks to step forward with their stories. Whether you're Native American, Asian American, if you're Black, if you're Hispanic, learning those stories will help other people gain access to treatment. And so it's important for us to have a conference that looks diverse, for example. It's important for us to have leadership here that looks diverse, because if we don't have that, then we're not going to have a safe space for folks to feel like they can come in and get treatment. OCD is not a white disorder. OCD is not a middle class disorder or a poor disorder or a rich disorder. OCD absolutely does not discriminate on who's going to get it.
And, you know, the other thing that I wanted to also mention is that even though we have a diversity advisory council, we're also learning, right? So as a group, we come together, we're chatting, we know that there are problems. However, we don't have all of the answers. And what starts that conversation is how we get to some of the strategies and some of the solutions that we've come up with in the strategic plan. But even as we started the council, you know, we know, okay, there's this issue, right? The people of color aren't getting the treatment that they need. It's not available. People of color aren't trained in OCD, probably because people believe that OCD doesn't really exist in those population, right? So we know that there are these problems, though there wasn't any one of us who had all of the solutions. You know, we had to brainstorm and think about, well, how can we tackle this barrier? How can we overcome this challenge in order to reach those goals? So it's an ongoing process, and we're still learning. I can't say that I know every little thing about diversity or I know everything about it. So it's a conversation. I hope this continues to be a conversation where we get to continue to learn and grow.
Absolutely. That's really well said, both of you. I think something that sticks with me is we've had people say to us that, you know, they came to our site or they came to an event and they just felt so alone, even though they were surrounded by people who theoretically understood what they were going through for, you know, living with OCD or being a clinician or being a supporter. But because they were, you know, one person of color in a sea of white, they just continued to feel alone. And that's almost a separate layer of alienation and stigma and shame that it really breaks my heart to hear about. And it's as Jenny said, it's an ongoing journey, ongoing conversation. And we're absolutely looking forward to continuing it, you know, as a board and staff and as the council, and also with you all moving forward as part of Minority Mental Health Month and beyond. And yes, so we did post the link if you guys want to learn more about the council. You can kind of, we have a historical timeline of some of the stuff we've done. We're going to talk through some of that in a second. We have a little, we have some slides to go through just to lay things out. But the council is fantastic. Everyone said it, but it's made up of, we tried to be as representative as possible. So we have clinicians, we have researchers, we have parents, families, we have individuals living with OCD. So it's a really well-rounded group, and everybody brings a separate skill set and expertise and perspective to the table, and it helps us do the best we can. And just one more thing before we move on, that Jenny, you said earlier about how it's kind of a low and slow process. That's kind of how we like to do things at the IOCDF. It can be frustrating at times, but if we do something, we want to make sure we do it well. Unfortunately, that means it sometimes takes longer than you would like it to take. So that can be frustrating. I know for us as staff who are trying to get things done and kind of move the needle a little bit, and also for our community, to feel like maybe you're screaming and nobody's listening to you. You keep telling us we need this, and we keep not getting to it for a while. But we hear you guys, we see you guys, and we are working on it. It sometimes takes some time, but hopefully that's all for the best, because it means we're going to have a better quality product, for lack of a better word, at the end of the day.
There's just,
well, also, I wanted to reinforce what Susan said earlier, which is we're all volunteering our time. So therefore, we do want to do more. Don't get me wrong on that. We want it to go faster. We want results, except again, we do have our other commitments that we have responsibility for. So therefore, we can always use more help. We can always use more volunteers, people who are interested in this topic, people who are passionate about this, just email us.
There's so many great stories too of how people have taken leadership on this. I think it was our last conference, actually the last two conferences. I like to hang out in the pediatrics program and end up volunteering a lot of my time there. It's probably not surprising. And there was a young girl, probably 8 years old, who is Middle Eastern, and was there at the conference, and just had the most amazing time meeting other little 8-year-old kids who were experiencing the exact same thing she was experiencing from a mental health perspective. And it cuts through barriers so quickly. It is just about OCD when we sit down and talk. And what was pretty amazing to me was the willingness of her mom and herself, her parents and herself, to allow her to be photographed and used in some of our materials. And the amazing thing about that small moment of volunteerism is that it makes the conference or our materials more accessible to other people who are seeing someone of Middle Eastern descent address OCD, and they're able to recognize in that themselves in a different way. And that kind of volunteerism, there's no way to explain how much that means to other people. We get comments about that all the time. I finally heard my story when you spoke. That's so important. And we really look forward to these diversity town halls, encouraging folks to come to volunteer with us, to learn more, to attend our conferences, which is virtual this year. So it's really, really easy access all around the country and the world. And we're excited about that.
Great. All right. Well, then, so I think we're going to maybe move on to questions 2 and 3 that we outlined. We're going to kind of answer them together in some ways. So just to reiterate what those are. So we were going to talk a little bit about what the IOCDF has done in the past and what we're currently doing. And then also what can we do moving forward? And especially when it comes to the what can we do moving forward, we'd love to hear if folks have thoughts. As we've been discussing, the Diversity Advisory Council has worked really hard on a strategic plan that has been guiding a lot of what we do. But we are always open to new ideas. So I especially want to invite the folks in the audience tonight and who are watching it anytime hereafter to think about that. Think about how we as the IOCDF can better serve you. So just keep that in mind as we kind of move through the next piece. So Fran, if you want to pop on the PowerPoint. All right, so I'm just going to start with just some general things that the IOCDF has done and is currently doing, and then we're going to kind of break it down by specific audiences. So I'll start with the general, and then we're going to talk about what we have been doing for individuals and families, for clinicians, and for researchers. So just in general, we've talked a lot about our Diversity Advisory Council, and again, the link is in the comments if you want to click on it to learn more about who we are and what we do. As we were actually just discussing, we have tried to focus on having diverse representations in our images because we know how impactful that can be, just going to a website and seeing a brown face or seeing a black face and saying, yes, this is for me. This isn't just a white people's thing, as Susan was talking about earlier. Excuse me. And then we've also started to collect demographic information at our events and at various other points of contact with us, just because we need data. We need to know how we're doing so we can know how we can, so we can know if we are improving and if the things that we're doing as a council and as the foundation are working to try to make our community be more reflective and inclusive. So I can tell you at baseline, this is likely not a surprise to anybody, but people who are involved with us are overwhelmingly white. And that is, we love having everybody with us, but we also want to try to make our community look like the community of those who are affected by OCD and related disorders. So the data is telling us that we are starting from a certain place and we are going to keep working to improve upon it. So next I'm going to pass it to Susan, who is going to start talking about the things for individuals and families.
Yeah, so one of the things we realized when we started working with the Hispanic community in particular was that we needed to have a more inclusive website. And so that's been a real focus of ours over the last few years. And we have translated a lot of the content into Spanish, and we've had a lot of volunteers contribute to that. And we find that having different languages on the site, having the site translated into different languages is very, very important for access. So that's something that we're already working hard on and have quite a bit up. We also, for example, at the conference, we always have a Spanish language track and also bilingual events. And so that's super important. Whenever we have walks, we make sure that we focus on that. And I think, Steph, we were talking earlier today, someone asked the question, one of the speakers on an upcoming diversity panel in July asked, well, I don't speak great Spanish and someone else, or great English, and someone else immediately said, well, I'll help translate. So that was terrific. But then Jeff pointed out to us that we were actually going to be, or maybe it was Steph pointed out to us, we were actually going to be doing a Spanish track of our town halls. And Steph, what month were we going to be doing that in?
It's actually, we're going to do, so I know we talked a lot about the online conference. We're actually going to be doing a whole online event that's in Spanish. It's going to be in September in honor of Hispanic Heritage Month. So keep an eye on that for more news in the coming weeks.
So soon to be posted. We also have on our resource directory. So our resource directory, if you haven't been there yet, is where you can go to find a therapist, for example, if you want to find someone that specializes in exposure and ritual prevention therapy. And so you can filter that by race or ethnicity. You can filter it by language. And then we have an inclusion of a diversity statement as well on that. And then the programming at the OCD conference is terrific. And I think that leads us to sort of an area of an improvement. So we have a really good Hispanic track there, and we always have a few sessions that are focused on diversity. But I think what we're really leaning towards going forward is having a diversity track so that it's really called out and so that folks can see where we're going to be presenting research around diversity, that sort of thing, where they can go to learn about a little bit more. So I'm going to let you go back. Fran is in the background working for us. So you can go one more forward, Fran. So our next steps are just continuing to have easier access to that translated content, really working a lot to report on what we're doing around diversity. So we have a newsletter that goes out, and we're going to work on both monthly blog posts that we're going to post about what's happening around diversity and OCD, but also have a special section in our newsletter to report on research that's happening or what's coming out of our Diversity Council. So it'll essentially be a feature for the Diversity Council every month to make sure people are aware of what we have, what the strategic plan looks like, what else we're going to be doing. And then I think really importantly is building partnerships with other organizations, which this is something we found to be very effective. For example, when we're talking about postpartum and OCD research, we've partnered with another organization that's really going to help us disseminate that information and understand how to best reach out to folks that are having postpartum OCD. Well, similarly, when we are doing work around minorities and diversity, there's lots of folks that are already doing very, very good work on that, that we do not need to repeat. We just simply need to partner with them to disseminate information or to do training on what OCD is. So that's an area that we're very excited about moving forward. And Steph doesn't often toot her own horn, but she is really terrific at building alliances and at reaching out to other organizations to figure out how we can train them about how OCD is a part of their population and therefore increase the reach that we have into the OCD population.
Yeah, that's great. And just to expand on what Susan said, something I have personally been dreaming about ever since I started at the foundation is having one of those beautiful little en español buttons right at the top of the page. And it is coming, and I am so excited about it because we actually, through a fantastic partnership with the Universidad de San Francisco de Quito down in Ecuador, we are translating all of our website content into Spanish. So currently we have a lot of stuff on our main page that's available. And it's just not that easy to get to, but it will be very soon. And they're going to help us translate all our sites. So it won't just be the main site. It'll also be the kids site, our hoarding site, the BDD site, and anxiety in the classroom. So everything we offer will be accessible to folks who speak Spanish. And then we'll see what else we can do with other languages. I know we've had partnerships with other volunteers and with some of our global partners. I think there was a group in the Netherlands who was helping us translate into Dutch, and then some volunteers who are helping us with French. That's absolutely a way if folks want to get involved. If you have a language skill that you're willing to donate some time, feel free to get in touch with us and we can work with you around starting to get our website translated. And yeah, I don't know if Jeff or Jenny, if there's anything you wanted to add about individuals or families. Okay, great. And then again, as we said, this is not an exhaustive list. This is not all we're planning to do. These are just some of the highlights. And of course, if anyone has other thoughts, please feel free to get in touch. We'd love to hear more about what you're thinking. So next I'm going to have Jenny talk about clinicians.
Well, just also to go back one, we're going to be starting that section with the blog spot and the articles and the newsletter and the website. So as what Susan was saying earlier, it's these stories that people can relate to. It's the stories that are meaningful. So I would encourage anyone, if you have a story, please send it in. Please let us know so that we can highlight it and other people can relate to your experience and feel more comfortable, because what's the worst thing is feeling stigmatized for having OCD, even though we know how prevalent it is. And the rates that we have is definitely less than what it actually is, because people feel that shame and guilt. So if you have a story, if you're a person of color, even if you're not a person of color, share your story.
Yeah, and we have Faces
so
of
now
OCD
I can talk
campaign. Oh yeah, so sorry, just quickly, because you reminded me, we have a fantastic campaign that's perfect for exactly what you were just saying, Jenny. It's a hashtag Faces of OCD. There's a formal process where you can submit, and Shira will interview you and we'll post it as the blog post. Or of course, you don't have to necessarily do the formal Faces of OCD, but that is a great way that already exists to plug in. So, all right, go ahead, Jenny.
Okay, so clinicians, what we do know is that many of the clinicians whom treat OCD, they aren't from diverse populations. What we know is that we need to do more to train clinicians of color to have the skill set to treat OCD. So what one of the goals that we have in the Diversity Advisory Council was how can we expand that? So in the last few years, we now have the professional scholarship programs where there are specific scholarships dedicated to people of color, to the minority population. And the BTTI is the Behavioral Therapy Training Institute that does, I think, quarterly trainings?
We do seven
7.
7 a year.
See,
Yeah.
I'm still learning. 7 a year, right? And a part of that is going to be dedicated to people of color. So if you are a clinician and you are interested in learning how to treat OCD, by all means, apply for the scholarship. I think the Peace of Mind Foundation also supported some of the scholarship, or is providing the scholarships.
Yeah,
So
this is from Liz McInvale and the Peace of Mind Foundation that allowed us to do this. It's a $25,000 yearly grant that reduces the registration fees, that makes it more accessible for individuals. It's also for therapists who work primarily with individuals of color. So it's a really cool scholarship.
And
right.
to plug for that training, the BTTI, we get amazing reviews on that. It's a terrific experience. It will really expand, if you're a therapist that's interested in working with OCD, it'll really help you expand your client base. And if you work with people of color, please apply for that scholarship.
Most definitely. So again, something that's to be considered. Most clinicians of color, not only are they not aware that OCD is so prevalent. I mean, I myself in grad school, we never really learned much about OCD. It wasn't till I did one of my internship training at the Behavior Therapy Institute with Charlie Mansueto that I went, oh, wow, this is really prevalent, right? So even though we're in this profession, you'd be amazed at how little is known about OCD, even within the mental health community. So if you are interested, by all means, apply for it. And if you know of other people who might be interested, by all means, share this information. So what we talked about earlier is that we're focusing on a specific track in the conference that will just be a diversity track. I think in the past, we've had diversity panels, we've had diversity presentations and workshops, though, I think now that we are implementing a specific diversity track, that's really emphasizing to researchers, to clinicians, to families, hey, this matters. So we're putting focus on that, and it's right there, it's visible, just like we have with the pediatric track and the BDD track and all of the other tracks that are available at the conferences. If you go on the website, there's a tip sheet on working with diverse clients with OCD. So that's, so even if you are a person who's not in the minority population, though you do work with minorities, it'll be important for you to learn more using this tip sheet. And even if you are a person of color, so like for myself, even though I'm Asian, it doesn't mean that I am competent or skilled at working with every single different diverse population. So I think it's important just to even take a look and learn, and perhaps there'll be some areas that you can let us know whether we're missing some things, right? We're always open to having more information, having more suggestions. That's how we can keep this dialogue going. So as what Jeff and Stephanie was saying earlier, we've been attending specific conferences geared for minority clinicians. So that's something that we will continue to do, except again, what we don't know, we don't know. I mean, we can do a Google search of all of the conferences that exist, and we still might miss some of the major ones. Again, we're open to hearing more. We're open to learning more. So if you feel like, okay, we we have a huge minority representation at these conferences, yet there's nothing about OCD. Please let us know. We'd be more than happy to not have to do that research, to have that information, which makes our lives easier. But we are dedicated to attending more of these conferences just to spread the word that OCD exists. Again, OCD doesn't discriminate, and just raising that awareness. So we talked about the programming at the annual OCD conference, right? That we do have various presentations that's focused on working with minorities. And if you attend the virtual conference, there will be some at the virtual conference in July as well, or end of July. Great. So the next slide, or... Okay, so of course, you know, we can always do more, right? We can always do more to provide more scholarships, to provide more training. However, we all need help. So, you know, we're always looking for support from our community, support from even outside of our community to continue these professional scholarship programs. And again, like what Susan was saying earlier, that we are searching for people who would be interested in joining the board. So if you know of people, please let us know. And again, just like what we said about the tip sheets, if you know of information that we're missing, please let us know. We can't say that we know everything. So I'm sure we're going to be missing bits and pieces of information. And then there is a webinar coming up, right, Stephanie, about cultural awareness and OCD treatment. So watch for that if that isn't available just yet. And I believe we talked about partnering with other organizations in order to continue learning and building and evolving this dialogue.
And Jenny, I think when you talk about partnering, I was also thinking about postpartum OCD, and that as we, so Jenny and I both sit on a subcommittee to talk about postpartum OCD, and obviously postpartum OCD is something a lot of people do not know about, they're not well educated about, and it affects our minority communities as well as our non-minority communities. And so the overlay of diversity is sort of never ending, because we're thinking on the one hand about how do we teach clinicians about recognizing postpartum OCD and how to educate their clients about it. But then we have to overlay on top of that, okay, but also how do we make sure that we're reaching out to people who will ensure that diverse communities know about postpartum OCD. So the work here is really never ending. I think every topic that we come up with around OCD will have to do an overlay of how to think about that from a diverse perspective as well as from a general perspective.
Yeah, I think that's a great point, Susan. And it struck me that there was a conversation we had previously with the council about how, you know, obviously we are focused on diversity here, and that's kind of the topic for tonight and for the month. But at the end of the day, our overall goal is for our community to be diverse. And that doesn't mean that the people who are of diverse backgrounds are only here to talk about diversity issues. Right. You can be a clinician with OCD who is a person of color, and you don't specialize in treating people of color, but it still matters that you're there. It still matters that you're part of us. And we would never, and I think what you said, it's just part of who we are trying to be as an organization and part of what we want our community to look like and represent. And I think that was a really well said.
Yeah, and I'll just add a couple other things. So again, we've had the scholarship fund for a couple of years now, and we've been able to train, Steph, how many? About?
So last year, I think we gave out around, it was, quick math. Oh no, don't put me, my math is a work in progress. So it was about 8 times 6.
Yeah, so about 50 folks. Okay. And so we wanted to wrap back around to those individuals who who receive those scholarships, and we wanted to start profiling them about the important work that they're doing, and also as a way, so on that Diversity Advisory Council page maybe, or in the newsletter, to say this person got the scholarship, here's the work that they're doing, and also to just make sure that although they got that 3-day training, are there other supports and community building? Do we build a kind of community amongst those therapists so that they have a community? So again, just kind of building on some ideas and providing other areas to connect. You know, the other story, as you guys were talking, is having met someone in the 2017 conference. I'm walking through the registration area, and I run into this African-American couple, and I'm talking to them, and our photographer walks by, and I say, hey, Bob, can you come over? I want these guys to take a picture with me. Do you guys want to take a picture with me? And they say, we're going to end up on all of your marketing collateral, aren't we? And I said, yes, you are. If you're okay with that, let's take a picture. And they did. And then, you know, it was the wife who had OCD, and then she got involved as an ambassador. And then she's gotten involved in the Diversity Advisory Council. And so again, you know, this is kind of going to be the theme that you hear from us, is there are lots of opportunities. There's no way we could get our education on our websites translated into Spanish if Marielle and her students at Enkido weren't translating all this stuff. Steph can't translate all that. That's a full-time job, right? So the more participation we get, the more we can do. And so again, I just think that that's going to be part of the theme that you hear.
Great. All right. So in that case, then we're actually gonna keep it with you, Jeff. We're gonna move on to talking about researchers.
Okay, so we've been doing the research grant program since 1994. I think we've given out now about $7 million in research grant funding. And, you know, again, I think it was Monica, you see here in 2009, we funded a project by Monica. And what she found in that became kind of the guidelines for us and others about how to include more women and minorities in the grant proposal system, whether it's as reviewers, whether it's as do proposals get extra points for saying in the proposal, here's how I'm going to go out of my way to recruit people of color to participate in my research. So again, that has become part of our research grant review process. And again, all three of these projects have been great projects. Now, again, there's 3 projects. That's a problem. The problem isn't that we're getting lots of these submissions and they're not getting funded. The problem is we're not getting lots of these submissions. And again, I think that goes back to us not going and looking for these researchers, us not going and supporting these researchers, us not going to, again, conferences where we were going to run into people of diverse backgrounds that were wanting to do research. And so again, I would love to see, and you know, Susan, you're on the board. When these kinds of projects come across and the board votes, everyone is always super excited when we can get more information. At the foundation, we don't just make something up and put it on the website. It is literally everything we put on the website is derived from research. We are a research funding, research supportive organization. And so again, if we're going to include people in not just in our community, but understand, again, through this kind of research, why aren't people engaged in our community? I think some of the findings of this research were involved in the tips that we were just talking about, were involved in recommendations from the Diversity Advisory Council. So again, all these things kind of feed back to each other.
And just before we move on to next steps, I think, you know, the point that we were discussing earlier applies here. So it's both, we want to have more people of color involved doing the research, but also participating in, because it's an issue. I mean, in mental health and honestly, any kind of research that it's all based on white data. It's just because that's who's participating in research. And, you know, there's a very, very valid historical reasons for that. I think we'll probably end up talking more about this in a future town hall that goes into stigma in communities of color and kind of the historical aspects, especially when it comes to participating in research. But yeah, so that's part of what that inclusion plan is we do now ask everybody who submits a research grant to tell us what their plan is for getting a diverse sample for their populations. And something that I guess we can transition to the next slide, that's something that we're gonna continue assisting them with, because we're not that great about following up about that, because everyone, they can say that they're gonna do X, Y, Z, but we don't necessarily follow up with them. But I'm gonna let Jeff talk about the next steps here.
Yeah, so in terms of identifying gaps in research, providing funding to fill them, again, I think this is us doing outreach, going and exhibiting at conferences. Jenny, I loved what you said, and we talk about this all the time. We can go to these conferences and find out no one's presenting on OCD, and that just becomes this perfect opportunity, a win-win situation for people to, again, partner and share expertise. Technical assistance to help recruit more diverse samples for research studies. Steph, do you know about this?
Yeah, so this is actually, we've talked about the Diversity Advisory Council and the various subcommittees we have. Our newest subcommittee that actually was just formed last year, so it's less than a year old, is a research subcommittee. And kind of their two main goals are actually these first two bullets that we put here. So one is finding what we know and what we don't know about OCD in minority populations. I can tell you by putting together the content for the resource center that we'll be publishing soon, there's so many gaps of what we don't know. There's barely a single study, for example, on OCD in Native Americans. So and there's not even enough for any of the other various populations. So data is severely lacking. And then this piece about, okay, so you told us what you think you're going to do to include diverse populations as part of your sample. We know just from seeing what they publish of their data that they're not that successful at it. So the research subcommittee wants to start helping researchers do better about recruiting diverse samples.
Yep.
Right, and that came up at last year's Diversity Advisory Council annual meeting. And in our meeting, we realized there's just so much information that we don't know. And why don't we know this information? Well, there's not much research on it. Well, why isn't there much research on it? Well, we need a research subcommittee to focus on this and get us the data, and making sure that there is follow-up on the research that currently does exist. Mm-hmm. And, again, what Stephanie was saying, that we are going to address the topic of OCD and stigma in the minority population, because I see some of the comments there, and one of the comment is, how can you add more racial diversity to the IOCDF? This is a minority panel led by 3 white individuals. And I think Stephanie made that comment to start off this town hall. And it's not like we're not recruiting, we're not looking. However, there just isn't enough people who are coming forth, people of color, who is volunteering and say, hey, this is something I'm passionate about. What can I do to support? What can I do to help? What can I do to help this grow more? So, I just want everyone to understand that, even within the Diversity Advisory Council, we do have a lot of, well, we don't have that many members, right, Stephanie? We have some amount of members. However, it gets to a point where there's so much work and so little, not manpower, women power, not enough human power to get the work done. So, volunteer yourselves. If you see it as a problem, volunteer yourselves.
Yeah, and I appreciate Darcy asking that question. Thank you, Darcy. As we go forward into the future town halls during this month for minority mental health, you will see a lot more diversity on the panels. But what I hope you'll always get from us is authenticity. And so when we come forward to you as our leadership group, we're going to be honest about who we currently are, and we're also going to be frank and clear with you about who we hope that will become in the future and what steps we're going to do to get there. So here's our first kickoff on July 1st. And you're absolutely right. It's not a very diverse panel. And so that is a very clear statement. I hope that we're not afraid to talk about it. And going forward, that will have to be addressed. And that's from a board level, staff level, and community level that we have to address it. And only by addressing all, and community meaning people who suffer from OCD, that we need to attract more of those folks in, because they will move into leadership over time. That's how I entered the IOCDF, was just as a mom who thought there should be more pediatric programming. And I got super passionate about it. And my first entry was to say, hey, what about the third shift mom whose kid has OCD and they can't afford to drive 2 hours away to get therapy? And so the first thing we did was start doing lemonade stands to train local therapists in our area, because we didn't have any therapists in our area that were willing to treat a 6-year-old. And so that kind of passion is eventually translated into leadership. And so we know that if we attract more racial diversity in our population of folks who suffer from OCD and from our therapist community, that will automatically translate into future leadership. There's some short-term things we need to do in terms of that, but we also know that if we grow our base of folks that we work with, it will translate into racial diversity. I'm going to throw it over to Jeff and Steph just to talk about some of the future town halls, because you will see, I think, what you're looking for, which is a much more diverse representation during those town halls. This is just your leadership panel.
Yeah, absolutely. So I'll go over this again at the end too, just because I know we're going to talk for a little bit more. Oh, we lost Jeff. So our next one that's going to take place next week the topic is being a person of color in the OCD community. We're going to have 2 therapists and 2 individuals living with OCD on it. It's going to be fantastic. The week after that is going to be mental health stigma in communities of color. And that's also going to include a discussion of the resources available as part of that. The week after that is going to be racism and OCD, which we already started talking about some of the things that might come up in that panel. And then to close off the month, we're going to talk about trauma, including racial trauma, PTSD, and OCD. And all of those are going to be staffed by a mix of people living with the various conditions, therapists, and maybe even some family members and supporters as well. We're still working to fill out the panelists for the last couple, but the next bunch are set. So you'll absolutely start hearing more about them from us and plan accordingly. We hope to continue to having you with us.
Yeah. And I also wanted to say thanks to Leanne. I think that's a great example, Leanne, of how terrific this community is. If something is talked about on a panel and anyone has a question, we often find that someone in the community has answered it long before we can get to it. So thank you for answering the question about what scrupulosity is and giving such a great definition of it. It's one of those illnesses within OCD that we often have to explain, and what its overlap is with religion and how we may work with priests or rabbis, for example, in order to more accurately address that and have more accessibility to folks that are suffering from scrupulosity within their religion.
Absolutely. Yeah, it looks like Jeff's having a little connectivity trouble, but great. So another question that it looks Kira's therapy has asked, and we also got sent a question before the call, was about access to care. Because particularly knowing that a lot of people of color are in low or middle income communities, and so much of OCD treatment is in these specialized care centers that maybe don't accept insurance, they cost a lot of money, they aren't really located within low income or middle income communities. So, there's kind of a physical issue there as well, a physical location issue, excuse me. So I was wondering if anyone want to address that. I know it's a very big question, and it's a large issue that affects our entire community. So it's going to be one of those ongoing process things. I think there's going to be a lot of answers here. So, Susan, would you like her? Yeah.
Jeff.
Or Jeff.
So yeah, this is a huge issue in the OCD community. It's a huge issue in mental health. I don't know if the statistic is still accurate, but when I was working back at the OCD Institute, and we were fighting literally every single day. Like Mike Janicki would throw the phone across the room. We were so enraged all the time with insurance companies. That is a major barrier. So there's lots of barriers, right? So I don't know what I have. And then I go to a mental health, I figure out maybe what I have. I go to a mental health professional. Jenny was talking about this earlier. Through research, we know 1/3 of mental health professionals are still misdiagnosing OCD. 50% of medical professionals are still misdiagnosing OCD. So then you get into treatment, but you got into the wrong treatment. You don't know anything about ERP, right? And then in order for you to get proper care, you have to go to a specialist. Well, you know, when we talked with Alec Pollard, who runs our clinical training, the BTTIs and so on, and he said, look, I used to go into community mental health centers and I would train them. And when I trained them, they would all be like, I got specialty skills, I'm out, right? And we actually ran into that we did a community mental health training a couple years ago. And so I think one is insurance. So we've joined the mental health liaison group. Steph also kind of heads that up along with her 48 other things that she's doing. And that really is about lobbying with, you know, about 50 other mental health organizations around issues around access, around issues around insurance, around teletherapy. And so I want to give a shout out. I think Patrick McGrath, I saw him on earlier. He's the new clinical director at NoCD. NoCD started as an app, and it was meant to be kind of a standalone self-help app, and then the organization has morphed into a teletherapy organization with the app as an adjunct to it. And they are doing really amazing work in terms of lobbying with insurance companies. They're now part of Cigna's, a very big insurance company. To access is being able to get to the office, right? We know people that were driving, we've heard stories of 4 or 5 hours one way to drive to therapy. COVID, one of the silver linings of COVID is that it's really expanded access, and teletherapy is now the thing. And again, NoCD was, again, prophetic. They were there ahead of the game. But their idea also is, again, you know, you have lower overhead. So it allows, as a provider, if you're doing self-pay, it allows you to reduce your costs. And I think, again, they have scholarships through NoCD as well. But it's groups like that. Again, we can't solve all of these problems, but we can work with and partner with groups like that are able to solve some of these problems. You know, Susan's been on the board for, again, going on 10 years. And the conversation we've had for the last 10 years is we have to solve all the problems in the OCD community, and we just can't do that. And so now we're finding partners. And again, I think we've gotten smarter about, again, we don't have to figure this out. Let's find a partner who's already figured this out.
And we have a pretty good listing of teletherapy providers. I saw Fran just posted that up for us. So if you are looking, if you do not have access in your community, you know, one of the side benefits of COVID is that there is a lot more access to teletherapy. So I'd encourage you to take a look at that, and then just know that we're doing our best. We're partnering with people on it. We hear you. It's really important. And Jenny always has great ideas about how we might train more folks in those communities. So Jenny, do you maybe want to speak to that for a second?
Absolutely. So earlier we talked about how we need to reach more areas where people of color are training, right? So like what I said, even when I was in school, there wasn't any information about OCD. We had it in our, I don't know, one of the earlier psych classes, but it's not enough training so that you go out there and you think, oh, I can actually treat OCD. In fact, even in training, I don't know how many interns we get currently who are saying, we've never heard of ERP, right? So not only do the public haven't heard of ERP, even mental health clinicians have never heard of ERP, exposure and response prevention therapy, in their training. So I think one of the things that we have to tackle are these training sites, whether it is pre-doctoral training sites, postdoctoral training sites, fellowships, and perhaps something that we can work towards is partnering with these training sites so that we can educate, raise awareness about how prevalent OCD actually is. And again, you know, one of the things that is really, really disturbing to me is when we have patients coming in and they have suffered decades and they have been misdiagnosed again and again, even children being misdiagnosed and getting treatment that doesn't work, or there are clinicians who say they treat OCD, yet they're not treating OCD from even a cognitive behavioral standpoint. That to me, that's a huge problem for me. So I think just getting to the training sites, that is the first area of entry, right? So we can educate, raise awareness, provide training at some of these places, then more clinicians will come out of their training having the awareness, having the knowledge, and we can start there. Just the other thing about what Jeff was saying earlier about insurance, it is a huge problem. I mean, I have no idea how, even for, it's just a struggle with insurance companies. Their model is, delay, 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 deny, deny, deny. And, I think if we want to be able to make that change so that treatment is being reimbursed, we have to talk to our legislators. We have to send letters to our legislators. It has to change from, it's like upper management, right? So we all have to help to facilitate that change.
Yeah, and just to piggyback on that, so Susan mentioned before that one of the very few silver linings of the COVID pandemic is that teletherapy and telehealth is kind of growing in acceptance, and it's much more widely available. I can say that another silver lining is that on a policy perspective, there's been a lot of legislation that's been passed that mandates insurance companies will allow you to bill for teletherapy and telehealth, because so many didn't really before. So there's been some legislative changes that are theoretically temporary because they're part of the COVID packages, but there is some hope that they'll last beyond this. So I think a lot of just the way we practice is changing. So I think that that's going to have a lasting impact. And then I did just want to address the other thing about the BTTI and the conference scholarships. We mentioned that they're for clinicians of color and those who work with a wide variety of patients of color. We also prioritize people who accept public insurances like Medicare and Medicaid and the various plans under that. And I can tell you that in 2019, I just looked it up, we had 17 therapists who went to this BTTI who accept Medicare, Medicaid. And this year, and we haven't even given them all away yet this year we have 28. So it's maybe, if you think about that, that's about 50 in the grand scheme of OCD therapists, but it's 50 more than we had 2 years ago. So it's just another thing about another, I guess, angle at which we're working on it from, the policy perspective and from trying to get more folks who accept insurance to get the training. Great. Great. So we have some other questions here. Let's see. We have Laura, who is a cherished council member, has made the comment that multicultural and multilingual is also really important within the U.S. When it comes to care. And I can say before, if anyone else wants to comment on that, another thing we prioritize in giving these scholarships is people who practice therapy in another language, because so much research has shown that if people are doing therapy not in their first language, their outcomes are not going to be as good as if they can get it in their mother tongue, I guess, for lack of a better way of putting it. I don't know if other folks want to say something about that.
No, I think that's been a focus for a while. So, making sure that we have folks that speak the correct language at our conference, for example, that we can translate. We had some questions here earlier from someone that asked a number of questions about whether we would translate this for folks that are deaf. There are so many different ways that we need to make sure we are able to reach and give access to a diverse community. We hear you very clearly. And as we discuss our fundraising priorities over the next few years, clearly having access to additional funds to be able to address diverse issues from a wide variety and cultural issues from a wide variety of perspectives is going to be very important. And I hope we can continue to fundraise on that. And I hope we can continue, I know we can continue to keep diversity on the forefront of what we're focusing on going forward.
And, just to also mention, that's all part of training more people of color, training more diverse populations, because I can tell you, just because you know a specific language doesn't necessarily mean that you can do therapy in that language, as needed. So there are so many different nuances when it comes to languages. So it's important to train more people of color, and that is one of the main goals in our subcommittee.
Someone asked how my daughter was doing now, so I'll address that because I think it's always helpful. I saw Kira also said that it took her 20 years to get therapy, and that is extremely sad. That is one of the things that motivates all of us to get up every day and do the volunteer work that we do. My daughter was very fortunate, and this is something I've thought about a lot, because the reason she was fortunate is that when she started exhibiting pretty extreme signs of OCD at 3 years old, and then again at 6 and 7, we had other family members, cousins, who had been diagnosed with OCD. And one of the really nuanced things about diversity is that because we had already had people diagnosed in our family, it was easier for me to recognize what was happening in my child and to begin to find resources for her. So she was treated very early and is doing extremely well. She's in college. Well, she's not in college right now because COVID, but she's a freshman in college. She did very well in high school. She has friends. She's happy. There was a time when I worried very deeply about whether she would drive a car, be able to babysit other children, date. I worried about so many things. And the truth of the matter is that there's great hope within the research that we have around PANDAS and PANS, which is another topic for a different day, and also for ERP therapy and how it helps kids and adults cope. So she's doing extremely well, and I appreciate your asking. But the thing that has reminded me of as I have been looking and preparing for this call tonight is that if you are of a different background, different cultural background or different racial background, and no one in your family has ever been diagnosed with OCD, the minute we started talking about OCD, we were like, oh yeah, grandpa, he always freaked out when we touched his phone, and there were certain things we had to do in a certain order. And like suddenly you start seeing the generational path, right? But someone has to get diagnosed in order for you to see that. So if you come from a family where no one in your community has been diagnosed that you know of, when no one in your family has been diagnosed, you're less likely to understand that this is OCD, not ADHD, not bad behavior in a kid. So I that just breaks my heart. And it's so important that we reach out to those communities, and whether that is someone of color reaching out to their community, which is so important, or myself reaching out to a community just simply to tell that story with passion, we have to find ways to access those communities more effectively, because genuinely that breaks my heart. I cannot imagine if my child had suffered for 20 years. It was intolerable suffering for 5 years, far, far, far too long, very difficult early childhood. So we're very focused on that.
Yeah, and just to underscore, I think what we're all talking about. So again, I've referenced that I was at the OCD Institute for 7 years, and the opportunity came to take over the foundation. And it actually wasn't, I loved working at the Institute, but it wasn't a hard decision to leave, in large part because what I grew frustrated with at the Institute was hearing the stories of, I've been in treatment for 1 year, 3 year, 5 year, 10 year, 15, 30 years, not getting better. And that was actually the driving force in why I took over the foundation. And one of the first things that I wanted to build was the Behavior Therapy Training Institute. And so when I started, we were doing 3, and now we do 7 to 8 a year. And in addition to this larger training institute of advanced forums and webinars and expanding the conference has doubled in size. It really is unacceptable that people who are suffering don't have access to effective care when effective care is out there.
So Susan touched on this. I wanted to address, I see Lori, I apologize if I'm not pronouncing your name correctly, has asked several questions about accessibility. I just wanted to mention that is also, it's a different type of diversity, and it's absolutely on our roadmap for improvements to our website to make it more accessible to folks. And that will also trickle down to the events we do too, in terms of providing closed captioning and things like that. So thank you for bringing those up. And it's on our roadmap, and we're going to keep moving towards it. Maybe we'll do one more question, and then we'll maybe go around the horn for final thoughts. I see Mind Games has, the documentary has said, would love to address the issue of getting therapy across state lines. I will say that this is sort of it's a tough issue because legally there's limits, and I'll let the clinicians on this panel weigh in about the confines of what it means to be a licensed therapist in a given state. But I will say from the policy advocacy side of things, Jeff mentioned the mental health liaison group that we're part of. We're also part of another coalition called the Health Innovation Alliance that focuses a lot on teletherapy and kind of reducing the barriers around that. And one of the things that's part of the teletherapy is this interstate compact about letting therapists practice across state lines when it comes to teletherapy. So that's something that is being talked about kind of in the policy space, but I will let the clinicians talk about what that actually means.
Yeah, it's completely inexcusable. The medical profession can practice cross state lines. It's just, it's idiocy. Hopefully, COVID has broken down those barriers and legislators are willing to open those doors. If you're licensed in Massachusetts, you should be able to practice in Maryland and vice versa. Like, there's just no reason. Again, the medical profession figured this out. If the medical profession can do it, why can't the mental health community? So it's just, again, it's politics. But there's no real reason it shouldn't be happening. But there are movements and groups of people trying to work on this.
I agree with Jeff completely.
All right, well, with our last few minutes, I just would like to maybe go around the horn and have folks, if you have any parting thoughts you want to share, or action items or next steps that you think folks should be aware of. We can start with Susan.
I think my closing thoughts would just be that I am optimistic. And I'm actually very enthusiastic. It's so exciting to have ways to reach more people, to help them not to suffer from OCD. And that's literally why we're sitting here. It's because this disease is so treatable for so many people. And the treatment is exposure and ritual prevention. It's called ERP. And I often start my sessions with, when I speak with parents, by saying, if you ask a clinician if they provide ERP for OCD therapy and they say, ER what? Just hang up the phone and move on to the next person and find good care. And I think being able to get that information to minority communities, be able to train more therapies for minority communities, and especially to really be able to do more research on what the challenges are and to sponsor more research, those things excite us. So I hope we will follow through on that for you. I know we will, and I hope that you will get involved and that you will come and tell your stories. I promise you that your stories will make a difference to what kind of care is provided to people in the future.
Jeff, any parting thoughts?
I think my takeaway, particularly in the last few months, is, and Steph, you and I have talked about this, like my entire career has been around helping people that suffer, but like in my direct care experience, I worked with really seriously ill folks, and that's why I worked at the Institute. They were called treatment refractory. Sometimes it was that they just didn't get proper treatment, but they were complex cases. And so again, you're surrounded by that at the foundation, right? In a macro way, not even in a micro way, of all the suffering that's going on. But one thing that has been really underscored for me in the past few months is there's tons of suffering in the OCD community. And then if you're a person of color, it's plus, right? And I think that it's important to, again, remember the importance of turning up the volume, because it's bad for everyone, and then it's plus when you're in this community.
Jenny?
Well, so then the question is, what can we do about that? And I think going back to what Susan was saying, sharing that story. I think if we continue to have that stigma on ourselves, then we're just promoting the shame, right? If you're feeling shameful, if you're feeling embarrassed, then you're actually adding the stigma onto this condition that is very prevalent. Yet, if we can all find a way to talk about it in a way that is meaningful, in a way that is relatable, and in a way that helps us connect with each other, then that will destigmatize OCD. And if we can destigmatize OCD, then we're actually creating more of a space to continue to have this dialogue, to continue to allow other people to share that story. So it becomes kind of like this viral effect.
Absolutely. Great. Well, thank you, panelists. The IOCDF leadership, it's been fantastic to have this talk tonight and to hear candidly where we are, where we hope to go. And we hope you, our community, helps keep us accountable. We appreciate every time somebody does that. It never falls on deaf ears, and we appreciate that. So if this was only the start of Minority Mental Health Month, we've got some great town halls coming at you for the next couple of Wednesdays at 7 p.m. Eastern. Just to go on a quick review of the topics, next week we're going to go with what it means to be a person of color in the OCD community. After that, we're going to discuss mental health stigma in communities of color, including resources for folks. Then we're going to touch on OCD and racism, and then we're going to finish off with trauma, including racial trauma, PTSD, and OCD. So like and subscribe. I feel so cool saying that, but that can help you stay informed about the streams, both the minority mental health ones and all other ones that we may be doing as the IOCDF as we continue on in this virtual world. But again, thank you all for joining us. If you have questions that didn't get answered, please feel free to email us at info@iocdf.org. But it's been an honor to be with you all tonight, and thank you, and have a great rest of your nights, and we'll see you guys throughout July.